Hi, everyone. Welcome to our listening session, Conversations from Quarantine. Glad to be here with you tonight. Looking forward to a nice conversation about some issues that we're all facing. My name is Mike Murata. I'll be our facilitator for the night. I'm the director of the Richard West Assistive Technology Advocacy Center, which is at Disability Rights New Jersey. And we provide support to people across the state with disabilities who would like to use assistive technology to increase independence. And there's all of our information there, so please feel free to reach out. As your facilitator, I will just keep things rolling tonight. Just a reminder, if you weren't here when I said it before we started, there is a chat feature in the Zoom virtual meeting platform. If you are on the computer and you move along the bottom of your screen, a toolbar should pop up. And in that toolbar should be a chat button. If chat is not there, look under more. It's usually a button with 3 dots, and that should get you the chat button so you can participate. We have everybody muted, and we have your cameras off. If during the time we're together, if you turn your camera on, I'll probably just turn it right back off, just to keep the screen from being cluttered. So please don't be offended if that happens. And I'll let the members of our panel introduce themselves so you can get a sense of voices and who they are.
Hey, good evening, everyone. This is Michael Brower. I'm a supervising attorney on DRNJ's community inclusion team.
Thanks, everyone. My name's Jill Hogel, and I'm the managing advocate on our community inclusion team.
I'm not sure if Elena has audio, so but Elena Kravitz is on. She's the senior staff advocate for our institutional monitoring team and part of the PAMI program. I'm Lisette Nelson. That's me holding up the sign. I'm a managing attorney at Disability Rights New Jersey, and I'm also the coordinator for the program that we're doing tonight, which is the protection and advocacy for people with mental illness.
Hi, my name is Heather Sims. I am the PAMI Advisory Council Chair. I'm also the Deputy Director of Peer Advocacy and Community Initiatives of CSPNJ and a person with lived experience.
Great, thanks. Thank you, everybody, for joining us tonight. Just a little bit of background about Disability Rights New Jersey. We're the designated protection and advocacy agency in the state of New Jersey, part of a national network of protection and advocacy agencies in every state. We have a unique federal authority to monitor settings where individuals with disabilities live, work, and receive services. We investigate complaints of abuse and neglect. We provide legal representation and legal advocacy services to individuals with disabilities whose complaints are within our priorities. And we also participate in outreach activities, provide information and referral, and conduct educational trainings to individuals with disabilities, their family members, professionals, and other advocates and attorneys. So our PAMI program is our protection and advocacy for individuals with mental illness. Historically, has done significant work in our state institutions. Our community inclusion team has just begun looking to branch out some of those activities in order to reach community-based settings. So we've been making efforts to outreach to the mental health community so that we can better set our priorities for work going forward. This is even more important right now in the world of COVID-19. So an essential part of our PAMI program is our PAMI Advisory Council, whose members include recipients of mental health services, family members, self-advocates, attorneys, and other professionals. Our PAMI Advisory Council advises and helps set the priorities for our PAMI program. So we're happy to all be hosting this event as a way to reach out to the community and hear what you're experiencing to better inform our advocacy. We want to hear about the things that are important to you and let you know that we're here working and listening and hoping this is an opportunity for everyone involved to share your experiences and your concerns and hopefully resources. And that'll do it for me. Mike, thanks.
So this is Michael Brower again. I wanted to just do a little bit of a plug. DRNJ has been very busy on top of our normal advocacy activities, as Jill referenced, during the COVID-19 pandemic, trying to both stay ahead of possible issues coming down the pike and respond to problems as we learn about them. That's one of the purposes of our session here this evening, is to gather some more information to make sure that we have our eyes up on the horizon and that we're not just focusing on some of the issues we already know about. drnj-covid.org is our COVID-specific website. You can browse all the different activities, things that we've already done, letters that we've sent to the governor, to state regulators, issues that we've tried to address. Some of these already have some pretty good results. Some of them are still works in progress. It also breaks things down by team to see what's happening in institutions, what's happening in the community, what's happening in the special education world, and so forth. I would really highly recommend take a look at the website, see if there's some issues there that potentially might be impacting you. You might find something really helpful. Tons of resources available, links to our partners in the community, and links to some pretty good definitive governmental resources on specific issues. So again, it's drnj-covid.org, and Mike put the web address in the chat if you want to copy and paste. I'll pass it off next to Stacy Noonan from the Community Health Law Project, who's joining us this evening.
Good evening. My name is Stacy Noonan. I'm the managing attorney of the Community Health Law Project Trenton office. The Community Health Law Project is a nonprofit legal services office that represents clients who have disabilities. We were founded as one of the community supports in the 1970s for the folks who are being discharged from the state psychiatric hospitals. So we only represent clients with civil cases. We don't handle criminal cases or fee-generating cases like personal injury cases. What we do is direct legal services to consumers, primarily with mental health disabilities, who live in the community. We handle a lot of housing issues, landlord-tenant cases, evictions, habitability cases, issues with subsidies such as Section 8. We deal with entitlement issues such as appealing welfare decisions for general assistance and emergency assistance. We represent clients with Social Security appeals. We represent clients with home health cases, appeals or reductions or terminations in Medicaid benefits or private duty nursing cases, that kind of thing. We also have a contract to represent clients with foreclosure cases. And in our foreclosure contract, there is no requirement that that our potential client have a disability. We can represent anyone under the foreclosure contract. What we've seen specific to the health emergency are some issues with attempted evictions. We dealt with an attempted illegal lockout on Friday. We're dealing with some homelessness issues, people who are having difficulty obtaining services through the local boards of social services, their local welfare offices, and people who are being threatened with eviction from hotels, homeless individuals who have no place else to go. We're also helping people with questions about the stimulus checks, particularly individuals who receive SSI. And our contact information, I believe, is on the slide. That is our main number, our administrative office number. If you call that number, they will direct you to our appropriate office. We have offices around the state.
Sorry, everybody, I forgot to unmute myself. You should hear all the great information I just shared. So as we move forward, a couple quick housekeeping things before we get going on the meat of our conversation tonight. This is an opportunity for you to have your voice heard, and we have two ways for you to do that tonight. You can use the chat window. So if you logged in on a computer or a tablet, you have the chat window available to you that you can add your questions in. and have a conversation with the people that are here. If you joined us on the phone, and I know there are a handful of people that are on the phone with us tonight, the way that you could participate on the phone is if you would like to email a question. I will watch the email address as we move through our time together. And if I see a question come through, I can forward it to the panel members to share. And that email address is PAMI Questions. That's PAIMI Questions @drnj.org. So there's two ways you can connect with us throughout the time that we have tonight for our listening session. Before we go into your questions, which is great, this will give you some time to put them in the chat window. If you have some, the staff have identified a set of 4 focus areas, or we have 4 focus area slides coming up that they're going to speak to first, and then we'll open up for some questions from the group.
Hi, this is Lisette Nelson. The first area that we are suggesting that we would like to hear from you about is access to mental health and medical providers right now at this time with the COVID, since things have changed a lot, and in particular, if you're having access to telehealth services and what issues have arisen around that. So feel free to ask questions or comments on that issue, either through the chat or through the questions.
Hey, this is Michael. I just wanted to check in. So just to kind of give you an idea of things that we might be looking for in this focus area. I know that we've heard folks who maybe don't have a telephone, and Heather's got something in the chat talking about folks living in boarding homes who maybe can't get to a telephone. They need to get in touch with their provider, and they can't physically do it because there's not a telephone available to them. Things like that's kind of a good example of a problem that folks might be having in getting access to their medical providers during this time. Carolyn is reporting in from Atlantic County, saying she's actually got some positive to share. It's always good. I feel like sometimes we get overwhelmed with negatives. She's saying she's pleasantly surprised about the members who have continued access to their care in Atlantic County. That's some good news. So it sounds like folks are still able to tap into those resources that they need, or at least a good chunk of them are. That's a good thing. While people are kind of mulling that over, now maybe you've got an idea of what we're looking at. Mike, do you want to go to the next focus area just to kind of prompt the next category? All right, so this one is issues regarding stimulus checks. Stacy brought up this is a possible issue. So again, we'd like to hear anybody's thoughts on whether they've experienced some problems, either receiving a stimulus check, potentially somebody intercepting a stimulus check, having concerns about how a stimulus check might affect your benefits. These are kind of the things that we have on our minds, but we want to know from the community at large. What are the things on your mind?
Michael, this is Jill. Should mention that we do have some basic FAQs on that COVID website we mentioned earlier about the stimulus checks. So some of the basic questions can be answered there, but specifically if anyone is encountering a problem, that was something we would want to hear about.
as those questions are coming in, maybe what I'll do is I'll go through the 2 other slides that have some bullet points on them, and maybe that will generate some thoughts. I see some people are starting to write in the chat window now. And so
Yeah, that makes sense.
I'll just give you the next 2.
This is one that we've definitely heard from a couple different communities, and I think affects the disability community at large, is having a support person when receiving treatment. Again, kind of to give you an idea of what we have on our radar already, are individuals in acute care hospitals who might be there for either COVID-19 or maybe something different. And because of the high transmissibility of COVID-19, the hospitals have put in some no visitation policies. DRNJ has approached this as an accommodation issue, written to the Department of Health. And we actually got a pretty solid piece of guidance back from the Department of Health. Again, that's up on our website already. We'd be very interested if anyone's got individual cases where there was a problem. We'd want to hear about those through our main intake line. But we also want to see if anyone here has issues relating to having a support person with you if you need one while you're receiving medical treatment.
Thanks, Michael. And the final bullet we had as a focus area, perhaps to generate some conversation, was access to housing opportunities.
And this is a pretty broad topic. This one may be intentionally broad because I'm not sure if we have anything very specific on our radar already. Stacy mentioned evictions that are happening when they maybe shouldn't be happening. And the possibility with all the financial fallout, there potentially being some foreclosures and things like that. Not that, I don't know if that pipeline has fully opened it up yet, if we've seen the impact so far. But we want to hear if there are kind of hot issues right now, either folks facing evictions, folks seeing discrimination, potential discharge issues, maybe finding a place to go after you're in a hospital, stay, looking for a place to be discharged to back to the community. Again, these are kind of the ideas that we have in our heads, but we want to get a good idea on what's going on in your heads. And then I think we're starting to see some good activity in the chat box. So I'm going to switch gears. Instead of pushing through some of our focus areas, which again are kind of things that we've had on our radar in the broad sense, I think it's a good idea for some of our staff to take a look at the chat and see if there's any issues that we can kind of pull out on those and see if those are things we want to kind of discuss it and suss out to see if that's something we could add to our kind of scope on what we should be looking at as a high priority issue.
Nope, I'm finished with you. My baby? I don't think so.
I do see a lot of questions about the stimulus checks, so that really seems to be something important that I want to make sure we're hearing. And what we don't know for sure right now, we absolutely try to find out.
Yeah, and to kind of boil that down, it looks like some of the issues we're seeing with stimulus checks, I've seen it raised 2 different times in the chat, are folks who also have something less than documented immigration status, as potentially being either prevented from or not being able to receive the payment because they haven't filed taxes in the past. So what I'm doing, just as I kind of say these out loud, is boiling that down so I can make a note as we circle back after these kind of sessions and see where resources might be, if it's being addressed, if it's something we can address too.
I do see one or two questions in the chat regarding DDD services, and I kind of want to just not ignore those questions, but I also want to table them for one of our town halls that are specific to the DDD community. I'm trying to keep this focused to the mental health community and the concerns that are happening in there.
I believe the person had both developmental disability and a mental health challenge, which was the frustration with getting bounced back and forth, if I understood the question correctly.
Oh, I was looking at waiting list and summer camps. I didn't get to that one yet. Okay.
Yeah, the question is about people who have mental illness and DD or TBI and being bounced back and forth between the different systems with nobody accepting responsibility for services.
So Robin James popped in the chat and asked a question about whether all the questions will be answered tonight or another time. There are a few questions. There's some things that we have really concrete answers on. We might be able to share or point you in the direction of a good resource. A lot of the questions, though, we're probably not going to be able to answer tonight, but it's something where if we kind of see a trend, like right already we're getting a lot of interest on the stimulus checks, receiving them, how different statuses might affect your ability to receive those. Those are the kind of things where we might circle back to and see if we can either pull in an appropriate, either somebody from state government who might have information on that, an expert in the field, or maybe something that we'd look into ourselves and come back on a future town hall with some more information to share backwards. One of the things that we don't want to do is give out bad or half-baked information, have folks take that to the bank, and you know, sometimes having bad advice is worse than having no advice at all. So we're going to start there. Also want to just kind of reiterate, in case it wasn't clear, if anybody on the chat has any kind of real specific individual questions that they're looking for assistance with, DRNJ's intake line is open. We are representing individual clients within our priorities. So if you are looking for any kind of individual service, you should always feel free to give a call, work through our intake process, and see if it's an issue that we could assist you with individually to provide some more specific advice.
And I just wanted to say, for the person who was asking about the people who have both mental illness and DD or TBI, Disability Rights New Jersey has programs in all of those areas: mental illness, developmental disabilities, and TBI. So if you know people who are having problems getting services in whichever system they should be getting them from, they can certainly contact us about that. And we can speak to, you know, their individual situation, you know, through our intake process. I think there was also a question, or a comment, I'm not sure if, about stimulus checks in RCHFs. So I don't know if it was about how these are being handled. And I know that that's an issue that Heather said she had been hearing about from people. And I'm not sure if the question that was being asked was about who they're going to, but I know that we had some input about how that was being managed if the provider was also the representative payee. And we do have some information about that if that is the issue, because we know that if people get benefits that would go into a rep payee account, the stimulus checks are going to go to that account because that's the account that Social Security has for them. There are rules about how the representative payee is supposed to handle those funds. So I'm not going to go into all the details about that, but if you do have questions about that, you can certainly contact us, because you know, Social Security has put out guidance about that, which we can make available on our website if it's not there already. But we can also answer questions individually. And as Stacy said, they're also working on stimulus check issues, so they may be able to help you with those as well.
I do see a question here about support persons who there are not enough ASL interpreters who are willing to go out because of PPE. That's actually the first time I've heard about that. That's an interesting point. So that kind of falls into the availability of PPE being the issue. And then I don't know if that is something that would qualify for telehealth service, but I'm making a note of this to follow up.
And actually, Paula, if you can follow up in the chat, I'm curious on what settings is that kind of, you know, widespread, no matter where you're talking about. It's hard to get somebody to do ASL interpretation in person anymore. Or is that in particular, you know, in a hospital setting or in a psychiatric setting where there's, you know, normally you would have an interpreter available and just right now they're not? To see if there's any finer point or if that's more of a broad, it seems to be anywhere that you would normally need an interpreter. It's hard to get one now.
There's also a question in the chat box about discharges from psychiatric hospitals. I don't know, Lisette, if that's anything you can speak to, if you've had communication.
We have been having very regular weekly calls with the Department of Health regarding the situation in psychiatric hospitals and how they're handling the COVID cases. So, and from what they have told us and what we've seen, people who were at the point of being ready to be discharged and have a place where they can go safely are being discharged. And we, you know, one of the reasons, among many others, that we would like to hear about how the services are being provided right now and how people who are receiving services is one of the issues, obviously, for people getting out of the psych hospitals were they to be discharged now, is what services would be available to them, and if they would be able to have the level of services they need right now and be able to have a safe discharge. But we are in contact with the Department of Health, and we're also in contact with individuals within the psych hospital. So if there is somebody who we know of who is ready to be discharged and has a place to go, we can you know, address that with the hospitals to see if they are working on a discharge for them.
Okay, thanks for that extra detail in the chat, Paula. That's helpful to get us pointed really in the right direction. Talking about remote interpreting services, folks who are in psychiatric crisis or at a screening center. Obviously, yeah, that can be pretty tricky if you're trying to use a screen. It's never the same as if you're in person. So I appreciate that, Paula. That's helpful to get us really pointed in the right direction. Thank you.
I see there is another question about a stimulus check from Judith. My daughter is hospitalized and is mentally disabled. The hospital collects her SS. What will happen to her stimulus check? Again, you know, it's hard for us to answer specific questions without knowing more of the details in this forum. But as I said before, this is Lisa. The stimulus checks are not Social Security money, right? They're not the regular income that people get that goes to a represented pay or that might go to a facility where they're living that would pay rent. And so the money is the beneficiaries. If there are issues with somebody keeping the money or not giving the money to the person who it's supposed to go to or not using it for their benefit, then you certainly can contact us about that.
And this is Jill. I'm also curious to get a sense of who we have participating. If you're comfortable sharing, if you're a family member or a support person, or you know, where you're from, what region of the state you're from. That's information that you want to share in the chat. Feel free. That would help us direct some of our information.
Hello? Hello?
Hello, go ahead. Are you going to ask your question live? Go ahead. I think you're on the phone, so go ahead.
My name is Jean Wombold. I live in Atlantic County. I have mental health problems. I've also been a provider, and I would like to know what happened with people, even though they were doing good, but now because of the result of the pandemic, they're starting to lose ground. Where do they go for help?
Thank you, Jean.
I do want to share that there are a lot of resources. Jean, please feel free to reach out to me and I can share some resources with you as well.
This is Jill. I've been on mute again talking to myself. I see some people starting to share their information in the chat. Thank you. Wanted to say. We have a little bit of a mix, it looks like. There is a resource for, it's a hotline, a mental health cares hotline. I know we have the information on our website, but I'm going to also type it here into the chat. Calls are answered 7 days a week. I just can't type it and talk at the same time. So I'm telling you first, and I'm gonna put the information in the chat for people. Oh, there we go.
I see that there's a question about when are we going to do a DDD session. We have done 2 town halls for the DDD community. I'll turn this over to Jill if you, I don't know if you have another one scheduled now.
Sorry, I'm typing and talking.
Oh, sorry, or Michael.
No, that's fine. It's
Sorry.
fine. Yes, we've done 2 already. The transcripts, not the transcripts, I'm sorry, the webinar recordings are on our COVID website, so you can access the slides from both of those town halls and the webinar recordings. On our website, we are in the process of scheduling another one. We're just waiting for some availability from people we've invited to participate. So, you know, we're hoping within the next week or 2 to have another one. Just as we're hoping to have another one of these sessions, and kind of each one has built off the last one, which is what we are hoping will happen with this. You know, the first one is always a little bit, you know, kind of shaky because we're just really trying to get information and hear what everybody's asking. And then each one kind of builds on the last. So when we have the next one, hopefully we can address some of the questions that came up in this session, as well as, you know, hear more. I see how often are we holding these. So the first 2 DD town halls were a week apart, 2 weeks apart, I think.
2 weeks.
Was that right? Yeah.
Yeah,
So,
2 weeks.
sure. About 2 weeks. I mean, I think we don't want to go any longer than that for sure.
And with the DD town halls, the first was held in the evening like this. And then the second one was on a Saturday afternoon to give people who might not be available at one time the opportunity to participate at a different time. So we can look at doing that as well. If you have any feedback about what, you know, would be, if you have suggestions about what would be better in terms of time for people, when people would be most available, and if there are any suggestions about different ways to do technology to make things more accessible to more people. If there's some people who aren't able to participate, please, you know, feel free to use the chat box to make any suggestions you have.
Oh, so we do, I'm seeing that we do actually have a follow-up from this webinar on the calendar for the 13th. I don't have a time. 7 p.m. Thank you, Mike. So 7 p.m. on May 13th is the next scheduled webinar for PAMI. Yes. And I would really, anybody that we didn't get to or has, you know, a very specific question, individualized question, I would really encourage them to go to our website and either call or email our intake. You can do a number of things from our website. You can get some information. You can call and talk to our intake. You can get on our mailing list. So I would encourage everybody to try to check that out when you have a chance. Both our regular DRNJ website and our COVID website, which are two separate sites, just for clarification, so you don't think you're in the wrong place.
And on that note, to follow up, for any folks who are on the webinar now or are plugged into the mental health community in a larger way and may be able to kind of filter up questions to us, the PAMI Questions at drnj.org email address is going to stay active. If we see a pattern or a trend, like we've kind of heard some issues tonight for the folks who are participating, but other folks who maybe can't participate may have other issues. If we see something like that, we would like to be able to, you know, get as much of that information as possible. The earlier we get it, the more we can prepare in a webinar to try to deliver back some helpful stuff and have this be a little bit more of a two-way conversation instead of us just trying to get issues from the community. We want to be able to deliver some information back, and everybody can come away in a little bit better of a position. So again, that's PAMI Questions at drnj.org. Mike has put it very helpfully, thank you, Mike, back into the chat box. Any issues that you would like to see us talk about, if there's parts of the COVID-19 response that are particularly troubling or working particularly well. We always want to hear things that are working well so we can try to spread that around. So make sure you get those in, or if you can, again, filter those up from your network into our inbox. That's where we're collecting all that information in between sessions.
Thank you. And I see, thank you, Paula, has posted a resource in the chat box for St. Joseph Health Access. Is providing free emotional support helpline Monday through Friday from 9 to 5 for deaf and hard of hearing, 973-870-0677 during the COVID-19 pandemic. And I appreciate all the resources in the chat box. We would like to try to incorporate some of those into our COVID website to be able to share them with individuals who weren't able to participate tonight.
And this is Lisette. Sorry, I just wanted to make people aware of some of the other big policy issues that Disability Rights New Jersey has been working on in this time, because they really affect everybody who has a disability. In addition to the issue that Michael discussed about visitor policies, we've gotten a lot of feedback on that issue, particularly from people in the Didi community, but certainly it affects people with mental illness as well, because the issue of restrictions on visitors means that, you know, people can't have a support person with them, and if the person who's going to the hospital has communication issues or other issues that make it difficult for them to receive treatment without a support person, then not having somebody there becomes a big issue about access to health. So we did a lot of advocacy about that with the Department of Health, along with some other organizations. And as Michael said, the Department of Health has just the last few days put out a policy that hospitals are supposed to follow that allows a support person to accompany somebody who has to go to the hospital with, certain protections and restrictions, and obviously all the care that needs to be taken to ensure everybody's safety. But that was, something that really was important to a lot of people, because obviously many people are having to go to hospitals now, and generally, and so we want to know if hospitals are not enforcing that policy. The other thing that we worked on, because as you know, at the beginning of this crisis, there was a great fear that the hospitals may not have enough equipment and resources to be able to provide as much care as people needed to everybody. So far in New Jersey, that has not gotten to that point, luckily, but we and a lot of other protection and advocacy organizations nationally did a lot of advocacy about not allowing hospitals to just follow their own procedures regarding any kind of allocation of medical resources, and to ensure that there was no discrimination on the basis of disability around that issue. So again, the state issued a policy about that to ensure that the hospitals were not using any kind of discriminatory criteria in making those decisions. So again, if that issue comes up in any way, and I mean, the main issue that we were addressing and that everybody was most worried about was access to ventilators, but we know that there may be other access issues, even, decisions about who goes to the hospital, or, what happens once you get to the hospital, even if it's not getting to the point where somebody has to be put on a ventilator. So if you encounter any kind of issue like that, that you feel like the care that you're given is not the same as it would be if you did not have a mental illness or some other disability, then you should certainly let us know about that.
I also see a few more resources posted in the chat. This is really great stuff. Anne posted about CSP has peer respite teams offering intensive outreach services via telephone for adults dealing with emotional distress. Trained peer staff will help folks develop a wellness plan and give them the tools they need to navigate their crisis and emotional distress. There's 3 numbers for the Haladon respite, 862-239-9896, the Newark respite at 862-229-1401, and the New Brunswick respite at 732-354-4403. Reading out loud for the benefit of those who might not have access to the chat. Brielle also mentioned some excellent resources on the website for the deaf and hard of hearing. And ideally, what we would like to do is develop a written FAQ following this that we can put out to people, and I would hope to include some of those resources on that.
I think as we get closer to the top of the hour, I think I'm going to push us to our slide of final thoughts. Does anyone on the panel have something they want to get out there, a resource or a thought as we wrap up and we take these questions from the chat and start to formulate the next event?
Hi, this is Heather. I'd like to thank everybody for taking the time to join us tonight, and please continue to reach out to the the contact information for Disability Rights New Jersey. If there is a concern or a priority that you think needs to be addressed. So your voices are very important. Please continue to reach out.
As Jill had mentioned before, we do have another date on the calendar. And by on the calendar, I mean that the rest of us already chatted about it and we agreed that this was our next date. So we have May 13th at 7 p.m. What we'll do is we'll work through some of the conversation and questions from the chat tonight and hopefully have some next steps when we see you on the 13th. You can continue, I think Michael had mentioned it, you can continue to send your questions to PAMIquestions at drnj.org. We will collect those and use those as we go forward as well. What we'll do as we go forward from tonight's session, we will take the recording for tonight's session and process it and do all that other fun behind the scenes technical stuff that I like. And we will post it up to the ATAC YouTube channel. So if you go to YouTube and do a search for ATAC NJ, that's ATAC NJ, it will show up there tomorrow. And we will also follow up with everyone who registered tonight. We'll send you a link to that in your email tomorrow. And we'll follow up also with a link to register for the 13th as we go forward. We mentioned DRNJ several times. That's where we're from. There's our contact information. You can reach out to us if you're in New Jersey. You can call us toll free at 800-922-7233. Our other number is 609-292-9742. And you can always reach us on our website at drnj.org. I want to take a second and thank all of the panel members tonight for your help and your guidance and your comments. It's truly appreciated. Thank you to everybody who joined us tonight. I appreciate everything you added in the chat window, and we look forward to seeing you the next time to follow up. So thanks very much. Have a good night. Be safe.